and counties remain ill-prepared to deal with the spread of COVID-19 pandemic. A report by a Ministry of Health Technical Committee shows counties lack personnel to contain the full-blown community spread in all 47 devolved units. This, as the number of cases continue to soar, with 379 new positive cases and 19 deaths reported in the last 24 hours. Let's get more from our very own Dorcas Wangira.
Ministry of Health's report on counties' preparedness, dated August 14th, shows that majority of the devolved units do not meet the set irreducible minimum standards, especially in regards to staff to patients ratio. Cumulatively, the 47 counties have 5,984 healthcare workers, majority of whom are nurses with less than 100 medical doctors to deal with COVID-19 complications. The report shows that although most cadres are available, the number of personnel is inadequate across the cadres.
The cry is still the same. We need more staff. We need more doctors. We need more nurses. We need more lab technologies. So the WHO ratio says that we should have 1 nurse to 6 patients. You'll even get 1 nurse to 100 patients. This is there. It's happening.
Long after the deadlines for the counties to meet a threshold of the 300-bed capacities, the counties cumulatively had 7,937 beds, comprising of 7,618 isolation beds and 319 ICU beds in health facilities. Counties like Kakamega, Kiambu, Nairobi and Nakuru have exceeded the 1,000 mark for isolation beds. However, the counties that lag behind include Isiolo with 164 beds, Lamu with 86, Samburu with 174, Taita Taveta with 212, Tana River with 186, and Tharaka Nithi with 244.
We are happy with our efforts, we are happy with our preparedness, and we think that we are ready to counter this pandemic.
The report further shows that most counties still do not have the capacity to facilitate testing, surveillance and response. Current challenges in laboratory services and testing is a weak link in supporting surveillance and COVID-19 case information. Most counties have general labs and have to rely on external lab services such as MTRH and KEMRI for COVID-19 sample testing.
Only reason why we are not testing in every county is just because of the combination, the systems that we have, and the fact that the reagents for those systems are not easily available.
Financially, 99% of counties have waived COVID-19 related treatment. Several counties have set up COVID-19 emergency committees to mobilize funding. However, there is still a strong opportunity for counties to enhance communication planning to create awareness on the pandemic and containment measures. The technical team advises that counties need more technical support to expand their physical health infrastructure by also refurbishing and upgrading unused facilities. More health workers still need to be employed and trained to handle the COVID-19 situation. The Ministry of Health should facilitate clear mapping of labs to counties and facilitate accreditation for counties seeking it, such as Narok, Nakuru and Bomet. The evidence of whether a county is fully prepared shows in the number of new infections, hospitalized cases and recoveries. The slightest lapse could see a rise of infections in a matter of days. 379 new positive cases were recorded in the last 24 hours out of 3,867 samples. This bringing the total caseload to 31,105. 244 recoveries were recorded, bringing to 17,612 the total number of recoveries. 19 more deaths were registered, bringing the national tally to 506. Dorcas Wangira, Citizen TV, Nairobi.